And now let me talk about something that Anita's already mentioned, which is the issue of workforce morale. And I don't want to duck the issue that, at the end of a year when we've had a very damaging and difficult industrial relations dispute, that of course takes its toll on morale. But that isn't the whole picture. If you 5 years ago worked at Wexham Park, you knew what the CQC subsequently told us, which was that the care there was unsafe. You knew that the workforce was disempowered and disengaged, and the CQC described the culture there as of learned helplessness. Well, Wexham Park was one of 27 hospitals that we put into special measures. It's one of 11 hospitals that came out of special measures following the extraordinary leadership of Sir Andrew Morris and his team at Frimley Park. And the CQC's view about Wexham Park is that there's been a culture shift. They note that the proportion of staff who would recommend that trust as somewhere for their own family to be treated has increased from less than half to more than 2/3. And of their 8 core areas, whereas before 6 of the 8 were inadequate, now all 8 are good or outstanding. That is an extraordinary turnaround. And in fact, what happened at Wexham Park is a reflection of something broader that I think has happened across the NHS, which is a truly remarkable response to the tragedy of what happened at Mid-Staffs. We could have buried our heads in the sand. We could have said, this is just something that's happened at an isolated hospital. It's nothing to do with me. No one said that. And the result of that is that we see an NHS which is, despite the fact that we're doing 4,500 more operations every single day, the proportion of patients being harmed in hospitals is down by 1/3, according to the Health Foundation. And that, of course, has an impact on employee morale. If you look at the NHS staff survey, despite all the pressures that we know about, the overall staff engagement has been going up. The number of staff recommending their own organisation as a place to work or receive treatment has been going up. Staff satisfaction with their level of responsibility and involvement has been going up. And the feeling of satisfaction in terms of the support they get from their immediate managers has also been going up. Now, there is lots to do. And I want to mention 2 things in particular where I think we can all do better in terms of staff engagement. One is we are still getting far too many stories about bullying that's happening. The NHS has shockingly high numbers of staff who say they're bullied. And we still don't have, across the board, although we have some outstanding exceptions to this, a culture where people feel comfortable about talking about things where they may have made a mistake or they may have seen clinical mistakes amongst their immediate team. And we will never become the world's largest learning organisation, which is my aspiration, unless we make it easier for people to speak out if they feel that things have gone wrong, or indeed if they may have been responsible for things that have gone wrong. So that's an important cultural change.